What I recommend for parents bringing their children for a first visit is get them excited. Use positive language and let them know that it's going to be a fun experience.
Head on over to one of the local bookstores. There's tons of books that you can get that talk about going to the dentist. Just kind of goes through, explains to the child what they're going to expect. I always say first visits in the morning, especially their first few visits, making sure they're fresh, they're ready to go. Mention it that morning when you're on your way. Don't give them too much time to think about it, and maybe get here 10-15 minutes early so they can get familiar with the office. We do have a play area out there with toys and books and coloring.
I think we put too much into our kids' heads, and they get real nervous because they have so much expectation that there's going to be these bad things happening, but it's not. It's just going to be fun.
We also tell them that it's, all the kids, everybody, big and small, goes to the dentist, and it's just something that they do twice a year. Less is more. Say very few things. Talk about we're going to count their teeth, their teeth might get tickled a little bit, and generally just we're making sure that the teeth look healthy.
The first visit, pretty much all we do is we clean their teeth, we count them, we make it fun, we show them how to brush their teeth. At the end, they get a prize, so it really can be a positive experience for them.
We always allow parents back in the room with their child if they feel it's necessary, but we do encourage parents to try to wait out in the waiting room. Children definitely behave completely different in front of their parents versus when their parents aren't around. The Dental Association likes to tell parents to bring their child as soon as their first tooth cuts. A lot of times we say between ages of 2 and 3, when a child can walk, can verbally communicate a little bit. And a lot of it really depends on the child. We have some children who can walk in, sit in the chair, let us count their teeth and take a look at the age of 1, and then we have some kids who are not quite prepared until 3. What we're looking for in a 2 or 3-year-old's tooth is we want to make sure that they're generally on track with getting their teeth, making sure that they have the right set of teeth that are coming in, make sure that they're not either orally delayed. The other things we're looking for is possible decay. We do see cavities in kids as young as even 1. And we just want to make sure that we can talk to them about nutrition as well, and how important what they're eating and drinking every day can impact how their teeth develop and function.
We work with a lot of kids who are maybe a little bit anxious or a little bit nervous, so with them we like to spend a little bit more time. And a lot of times what we do is we just show them everything that we're using. So we'll show them our gloves, we'll show them our mirrors, we'll show them the little tooth shampoo we may be using, just so that there are no surprises, and when they feel that they know that everything's going on, they become a lot more comfortable. And a lot of times it just takes a little bit extra time, and we know that, and we plan accordingly for that.
We never know with any child what we're going to be getting, what they're sensitive to, whether it's an autistic child or a child who maybe just has some sensory issues. I might go into the visit completely different, where they're standing in front of me versus just sitting in the chair because it's more comfortable and they're less anxious, as long as I can look in the mouth, make sure we're not seeing dark spots, and we take baby steps with them. I let them help make the choices on what we're doing as well, but being effective getting through the appointment, letting them know it's super important that we have to get their teeth cleaned, but letting them maybe possibly help us through that appointment. I don't think there's necessarily any one thing that's going to prevent anybody from needing braces. I would say to some degree, 90–95% of people could use some form of orthodontia. There are certain things that can help prevent things from being worse, like thumb sucking, blanket sucking, and pacifier use. Those are definitely things that can increase the need for needing orthodontia when you're older. Definitely we start seeing signs of needing that depending on how their jaw is positioned, how their spacing of their baby teeth are, but a lot of times we really won't know 100% until they start getting those adult teeth.
When we have a child that needs their first filling done, I usually tell them we just need to get you back. We have a sick tooth that we need to take care of, and all we're going to do is we're going to squirt a little sleepy juice next to the tooth. It's going to make the tooth fall asleep. We can fix that tooth up, and then in a few hours that tooth wakes back up and everything's back to normal and you're feeling good. Usually they don't even realize anything that we did on them because it goes so smoothly.
Here, we got a prize now?
All right.
It's just going to be a fun place to go every 6 months to make sure that your teeth are healthy and happy.
I think having a first successful visit, it kind of leads into the rest of their visits going forward. I mean, if they have one good visit, they think, wow, this was easy, this was fun, and I got my teeth sparkled. I think each subsequent visit is going to get easier and easier, and you're going to have a child who goes, looks forward to going to the dentist. And we actually have tons of kids who tell their parents they're super excited they get to come.